Good afternoon. It is Saturday afternoon. It is 4 o'clock. By golly, it must be time for the senior moment. This is Connie Clark with Home Helpers, and I think maybe we lost our warm weather. Cold is coming. I'm depressed. No, not really. It's going to be a beautiful fall. And today, I have got Mike Baker with me here with the Dirne Clinic group. And it's almost been a year since the Dirne Clinic and clinics and locations centralized into the old group health building. And a lot has gone on since then. And I thought it appropriate to bring Mike in and let's find out what's been happening over there since then. So welcome, Mike.
Great. Thank you, Connie. It's so nice to be here. We always love having a chance to let people know what we're doing. You know, it's so exciting to see the passion and energy that has just, I don't know, that surrounds this organization. It's a fun place to be. So there's lots of good things going on. Looking forward to talking about it today.
Yeah, I'm always seeing announcements coming out that something's happening or something new or something. So tell us, what's been going on over there?
Sounds great. Well, so since we last spoke, we moved into our new facility in January. And so for the audience, so they know, we have a board of directors that's made up of patients of the health center. So that's one of our requirements. So 75% of our board of directors are patients of the health center. And when we moved in, I told them, I said, we're moving into this building full. So we were able to combine the behavioral health department and the medical clinic together. And we had a little bit of room in there to add some new staff. And as of November 1st, we will have every single room full every day, every hour that we're open. We will be just at capacity with what we can hire for new providers. So we've been able to add about 3 new medical providers since we've started.
So how many total do you have? How many on the medical side and how many on the behavior side?
We will have, as of November, we'll have 5 physicians and 7.5 nurse practitioners and PAs.
There's a half one running around
person,
somewhere.
That's right. That funny math that you have to use when you're working with people. So part-time people that are working. So we've experienced some phenomenal growth. We have worked really hard to make sure that everybody knows that this is a community place to come, and that, you know, no matter what's going on in your life, you can come in the door. And that message has been received very well. We you know, at the start of the year, we talked about you know, the importance of the community really getting involved. And, you know, if you have insurance, come to Dirne and help us out, because your healthcare dollars go to support the care of your neighbor. And that message, once again, has been received so well. We have all these new patients coming in, and healthcare has become more than just a doctor's visit. Like, it's an actual cause for people. You know, when they come in, they're not only getting to feel better and get great care, but they're part of something larger. And, you know, it's just magic in that place to walk in and feel that energy when you're doing it. You can't help but get feeling better. Do
you have any sense of how big your patient population has grown since you've been in the new location?
Yeah, you know, I'm going to have to ballpark those numbers because we will finish up at the end of the year here. But last year we took care of about 12,000 patients during about 45,000 patient visits. And we're on track to being at about 15,000 patients this year.
Wow.
Close to, you know, a little over 50,000 visits. So there's a lot of growth that has happened this year. And, you know, we've done it not at the expense of the uninsured patients. We've added more providers, and they've been able to just take naturally what comes in the door. We're not discriminating anybody when they call and schedule. Do you have insurance? Do you not have insurance? We're taking all the calls and bringing people in as they need it. And it's really worked out great. And
you're probably one of the few providers that still take Medicare, because I know that has been an issue in the area so far as some physicians not wanting any new Medicare patients.
Right. Yeah, Medicare is not traditionally a great payer. And so, you know, the private offices, essentially they're losing money on those visits. We just come at it from a different perspective. So our uninsured patients pay $25 when they come to an appointment. So anytime I can get a payer that's going to pay us a little bit more than 25, we're so excited. We're like, great. You know, we can take care of a couple more patients from that. And so, we love it when patients with Medicare come in and Medicaid. I mean, that's nice. It helps make sure that we have a stable base of patients that can contribute more toward their care, that then allows us to provide more care for uninsured patients.
And I remember hearing about something because I had asked about making contributions to Dirne, and I was told that there was a fund that you could contribute money to, and it would go to pay for the $25
Right.
visit. What is that
Oh,
called?
this is so exciting. So one of the things that just our board believes, and one of my personal beliefs, is that nonprofit organizations should do as much as they can to cover their expenses. And while some nonprofits, they don't have the ability to bill their patients or their customers for something that they do, we do. And, we have the ability to do that. And so for a long time, that was hard. We weren't necessarily covering all of our expenses, and we had to rely on the community to help. And that money that came in helped pay for rent and other expenses that the organization had. And while that's phenomenal and we appreciate it, we don't ever want that to go away, I wanted to get to the spot where we could say, every single dollar that you contribute is going right to help a patient. And so with the help of the United Way, for the last 2 years now, we've been able to set up what's called the Mary Ellen Fund. And Mary Ellen was the inspiration for starting the clinic. She's a lady that Ludwina Dirne knew that ended up dying because she didn't have access to good health care. And so we named it the Mary Ellen Fund so that donors can know they can give money right to that fund, and it goes directly to cover the $25 for that patient that they just didn't have. And we have just so people know, why we don't just give it away, we have a federal requirement that says we have to charge everybody something. And so that's that nominal fee that we are required to charge. And so this comes in and covers that. And, we always work with people. If they don't have the $25, we work with you, make an effort to, be a part of your care, and, we'll work with you.
And you all, one of the things that you've put in place since the end of last year is you've got 4 wheels going out.
We do. It's so exciting to see that out on the road. I had a chance to drive it the other day, and I love watching people's faces, as we drive by. Yeah, the Rotary Club of Coeur d'Alene and several other great donors came together and gave us money to get our mobile clinic up and running for the homeless program. And we launched that this spring. It's out a couple days a week, roaming the community, stopping at different sites inside the community, and just providing access to healthcare for our homeless individuals that typically aren't going to come into a clinic setting. They'll may be more likely to use the emergency department, and this is it's a great setting for patients. Before, we were doing it out of the trunk of a car and with tackle boxes, and this is a nice private, clean, phenomenal setting.
What kind of services does the mobile clinic provide?
Yeah, so we send out. So Ryan Smith is the director of the homeless program. He's a PA that runs the program and provides the services. So he does all basic family practice, that we can do out there. Pretty much, we can do whatever a patient needs that day.
Do they have a specific route they go on, or
they do? There are a couple of different places they stop. So they take it to St. Vincent de Paul, to the help center over there. We have a great relationship with Jeff Conroy, and St. Vincent de Paul does phenomenal work. We've had a clinic there off and on for the last couple of years, but now we take the mobile clinic.
Now, is this the location on Harrison or the one on Government?
The one on Harrison.
Okay.
Yep, over at the help center. So we do that, and then we have some days that we're over at Real Life Ministries, and then they're at Fresh Start, which is another great organization. And then they go out to different locations inside the community as patients need it, and our outreach team identifies them.
Is there, and where I'm trying to get with this, is there a schedule somewhere so that if someone wanted to know where it's going to be?
Yeah, the most consistent one is Wednesdays at St. Vincent de Paul at the Help Center.
Okay.
I don't know the date off the top of my head. I think it's like the fourth Thursday at Real Life Ministries, but someone at Real Life Ministries would know.
Okay.
And they can always call the clinic, and we can give that number at the end of the show.
Okay. And you've got, I know you have the behavioral health there, and you've got a homeless program going on. And is that the people when you walk in to the left?
Yeah, so we have a group of case managers.
Okay.
And case managers are the superheroes of healthcare. We love them. We have right now we have 4 case managers. One of them works with the homeless, or 2 of them work with the homeless program. One works with behavioral health, one works with medical, and the third one is doing, oh no, that's in the homeless program. So sorry, there's hopefully that added up to the right way.
That's because that doesn't add up.
But each of them, they're able to just become resources for our patients, and they're there to help. You know, when a patient comes in and they're having problems getting housing, or they need an appointment to a specialist, our medical team is able to connect them with the case managers, who then work with the patients to facilitate all the rest of their care. So we got a great team there now.
That's fantastic.
Yeah.
And I know you all have some clinic things going on outside of that central location.
It's
What's
really
going on with that?
exciting to see all the things that are happening. You know, healthcare in this community is changing. You know, everybody's trying to figure out what 2014 is going to look like. We've got a real political election going on, and healthcare is a big topic. And, you know, we won't have that discussion here today. But, you know, as we go forward, we know that, look, we've been here since '85. We're going to continue to be here no matter what. Our mission doesn't stop till everybody has access to great health care. And so we're looking at ways to expand and grow without a lot of additional funding, which is really scary and hard for us to do, but, you know, we're committed to doing it. So, I don't know, is this the time for our groundbreaking announcement?
Go ahead.
You know, we're really excited. You know, I just finished some paperwork with Dr. Michael Whiting, who has a clinic up in Rathdrum, who's a phenomenal guy, has had a great clinic going up there for many years, and we've agreed to partner together, and that will become it will still be the Rathdrum Clinic, but it will be a location for Dirne Community Health Center. And it's going to be great. We'll be able to open up and provide additional services for patients in the community. If you're uninsured, you no longer have to come in. You're welcome to still come to Coeur d'Alene, but you'll have a location right inside Rathdrum that you can work on. And we think it's going to be a great community asset up there. We can't wait to see what will happen when we bring all those things together and get it launched. And that's January 1st is when that will start. So we can't wait to see what happens.
And so let me now go back and think about the picture. You had all these different locations here within the city of Coeur d'Alene, and you've centralized all of those, and now you're outreaching to locations you weren't before.
Exactly.
Is that correct?
And that really was the goal. You know, we really wanted to stabilize the organization, get one central hub that we can work on, and then as opportunities arise, put satellite locations in so that, you know, care can be close to where you live. There's no reason you have to drive to Coeur d'Alene if we can put together a clinic that makes sense, that's right in your community. And we love the ownership that comes from having one of our clinics inside the community. I mean, people just wrap their arms around it and they make it their own. And we can't, I mean, that's what I'm so excited to see, is what Rathdrum can do with this.
Now, is that the first off-site, so to speak, clinic?
This is the first one. We have several others in the works, and we'll come back and make those official announcements as they come. But we can't wait. You know, physicians in town are, you know, they're kind of looking at the healthcare marketplace. It's hard to be a solo provider anymore with all the regulations and all the things that have to happen. We have a retiring physician workforce, and so we've got a lot of people sort of stepping back and, I don't know, looking in the mirror and saying, what is it that I want to do? And you know, Kootenai Health is growing. They're doing some phenomenal things over there, and so they're bringing on new providers. And, you know, we look at ourselves as another option for people in the community, so that, you know, if you're interested in staying in the community and maybe joining the hospital isn't your thing, and I don't mean that bad at all, but, you know, if you're interested in working with us, we'd love talking to people and, you know, helping you retain that feel of your clinic and making sure that it's a great place for you to continue doing medicine. And, you know, we try to take away a lot of the headaches of running the business.
Well, and I know our population is growing older, and as all of us get older and we get on Medicare, that is a big thing that we're afraid of, is my provider still going to continue to provide care for me?
Right.
And so knowing that there's options out there that will provide care, and it's not just someplace you have to drive, you know, to get to, especially in the winter, you know, when there's issues with driving, that there will be someplace local, I think means a lot.
Oh,
to
it
folks.
does. And, you know, we're committed to taking care of our seniors. I mean, that's just a group that, boy, they're just amazing. I love watching all the seniors come into the clinic. And, you know, we have people that, I don't know, maybe don't necessarily think they're seniors, but, you know, they're a little bit older and they're coming into the clinic and they're young and vibrant and active and ready to go. And we have people that, you know, are really struggling with their health. And knowing that that resource can be there, I hope is comforting. And, you know, we just hired a new provider. His name is Dr. Job, who's an internal medicine doctor. And we really brought him on just for that reason, to work with seniors with, you know, who maybe have a little more complex health concerns. You know, he started last week, and he's the coolest guy. He wears these bright shirts, and he's got this personality that you just want to give him a hug. He's a great guy, and, you know, we're excited to have him on board. And that's really to help take care of seniors, and all the rest of our providers. They're great. We love taking care of seniors.
That's fantastic. Well, I need to take a break, but I want to continue because I know you guys have been busy over there.
Sounds great.
So we will be right back. That's pretty cool. I didn't know you.
Yeah, we do. We've got him, and we hired Dr. Dan Jovichin as well. He's a provider in the community that's been here for about 13 years. He's coming on board too. So.
Your pediatric thing didn't
pan out,
yeah.
but we can talk. I mean, we can talk a little bit about that.
Are you still pursuing that?
We will have pediatric services at Dirne as we go forward. We still have to hire people and kind of make that happen. But I'm happy. I mean, happy to let people know about you know, that relationship with Dr. Akey. He's a great guy. And services are open.
Yeah, because
I know he's been on the show.
Well, no, his wife came to one of my networking things.
Got it.
And when she said the name, I said, "Oh, is that Dirne?" And she said, "No." And I went, "Okay."
Yeah. No, it wouldn't be a bad thing to have a brief conversation about that.
Okay. Okay. Is there anything else you want to?
Hiring. You know, let's talk about our dental clinic for a minute, if that's okay.
Because I know you were going to bring that over.
We're trying to move that over, and you know, we're getting to a spot that I'm not starting a capital campaign, but it'd be nice to be able to say, you know, we're working on bringing it over, and we're trying to figure out how to pay for it.
Okay.
That's something that'd be good.
Okay, you ready?
Yeah.
And we're back. This is Connie Clark with the Senior Moment, and I've got Mike Baker here with Dirne. And we've been talking about all the things that has gone on since they moved into the beautiful building, and I will say beautiful, over there. They brought all of their clinics in the Corleen area into one location, and now they're having clinics pop up in remote locations. So it's like everybody come together, now let's go out again. But one of the things that you had talked about initially when you went into this central location was that you wanted to bring the dental offices in. And that is something that hasn't happened yet. What's going on with that?
Oh, perfect. It's a good time to talk about that. Yeah, we offer full-service dental. We have 4 dentists right now that work off and on, and they work hard. They are just doing phenomenal work. But the space that they're in now it's full. We can't grow anymore, and you know we want to get them back home. It's nice to have everybody under one roof. So we have, when we moved into this new facility, we have about 3,500 square feet of unfinished space down in the basement, it's a beautiful spot. It's got windows.
That's like an open basement.
It's an open basement. It's really nice, and we'd like to put them down there. So what we're doing right now is actually just trying to figure out. We've got some basic plans, and we've got to figure out how we pay for that. It's going to cost us about $200,000 to bring it over, and you know we're trying to scratch our heads and figure out how we make that happen. But there's some significant savings. We estimate between $30,000 and $50,000 a year that will save us by bringing them into the facility, because we can drop off that lease and you know do some more efficient staffing, and that money can go right back into patient care if we can get it going. So we're excited to see what'll happen. My goal was to have it done by the end of this year, and I just don't think it's going to happen by the end of the year.
Well, that's why I brought it up, because I knew that was something you were wanting to do.
But hopefully, you know, in a very short time frame, you know, we're over there, and for sure by next year. How about that? Okay,
I'm going to hold you to that, because I'm going to bring you back, and we're going to talk about it. Now, we've talked about the seniors, and you've got a couple of new doctors in there that will be assisting with seniors. Well, what about the other end of the spectrum? the young people.
Yeah, it's interesting. Our community, we have a lot of young families, and one of the highest groups by percentage that are uninsured are kind of those young families.
Yeah.
A lot of the kids may have access to a Medicaid product, but some of the families make just too much to not qualify. And so we've got a lot of young families out there that are trying to figure out, how do we take care of ourselves and our kids? And we know all the moms in this community don't ever think about themselves; they're worried about their kids, and that's an issue. So we'd actually gone through the development of a pediatric practice with Dr. Kenneth Akey, who's just a phenomenal guy in this community, and we're excited to see what's going to happen with his practice. That ended up not turning into a formal partnership, but we're great friends. We refer patients back and forth, and we're going to continue to see that happen. Both of us are just going to continue to explore what that relationship will look like, and we know that pediatric services need to be available for our patients, and so whether it's with another with Dr. Akey or whether it's with somebody else down the road, we'll have some pediatric services available. It's a high priority for the board.
That's going to be something you're going to be looking for.
Definitely. I mean, we believe in this whole patient-centered medical home, and that this should be a place where everybody can come from birth to death. We don't want to kill you early, but we all know that we're going to go sometime
eventually.
And
yeah.
We want to make sure that your care is coordinated all the way in there, and that that you develop a relationship with somebody that can care for you through that whole lifespan.
Yeah, because again, in the community, if you don't have health insurance or you can't afford it or whatever, you should still be able to get health care, and not just in the emergency room of the hospital.
No, it's so expensive to go utilize those resources, for a cough and a cold. And everybody listening either knows a kid or has had a kid. And, the worst feeling as a parent is to have a sick kid and not know what to do with them. I've had my kids sick, and I'm helpless. I don't know what to do. And, our kids, I take them to Dirne. My wife's a patient of Dirne. We get phenomenal care. And knowing that they are being cared for by a great provider like that, it's really reassuring. And we know we can get in. I don't know if I told this story before, but my little daughter, Samantha, she stuck a Lego up her nose. And she, my wife's initial phone call was, "Hey, we need to go to urgent care. She got a Lego up her nose." And I said, "Hey, remember, I work at Dirne. We got providers that can take care of that." And, we brought her in. She met with Ryan Smith, and he just took care of her. But, as soon as that Lego came out, my kid's eyes just lit up like, this guy is Superman. He saved the day. And I love that relationship that anybody can have with a medical provider, because that's where you need to be. You're talking about intimate details of your life and how you feel. We don't even tell our best friends about some of the health issues that we're having, but you need to be able to talk openly with somebody, and you've got to have a trusting relationship with the provider. And I know that my kids, they're set for life. They know that they can come in and talk to somebody about that.
Well, and it's interesting because you and I have talked before, and I've talked to other people on your staff. And one weekend I had my granddaughter with me, and she did something, or it was during the week, and she did something with her foot. And so we were kind of concerned, and I said, well, let's go over to Dirne. Well, I took her over there and did not come and see you or any of your staff. Nobody knew that I knew anybody there. And we went through just a normal routine. We didn't have an appointment. It wasn't an emergency, but it was something that needed to be handled. And within an hour and a half, we were out of there. And we had seen a PA. They had taken care of us, and we were gone with what we needed. And I thought, and they didn't even know I was here. And someone might say, it's your
VIP treatment.
Yeah, it's your child. So, but nobody knew that I knew anybody there, and I brought her in, and we took care of it, and it was fantastic. And
good.
An hour and a half, and I'm gone.
Right.
You can't normally get in and out of a doctor's office when you have an appointment in an hour and a half. So it was really a very good experience.
It's good. I love hearing good stories. I know we're not always perfect, and we'll drop the ball occasionally, but we are trying so hard to make sure that when you walk out our doors that you've got a smile on your face, that we care about you, and that, you know, we had a chance to be your hero that day. And I can't, it kills me when that doesn't happen, and luckily it doesn't happen a lot. But, you know, that is our goal. You walk out the door knowing that, you know, we care about you, and come back.
And you guys have done some fun things throughout the year. I mean, you did the Muddy Miles, and those were fundraisers for Dirne? Or?
Yeah, I mean, really, they are fundraisers, and we make a little bit of money on those. But my biggest goal is helping people associate our organization not just with, you know, that's where the poor people go. Like, that's great, that's what we do, that's part of it, but this is where everybody should go. And so we want people to have fun when they're associated to our name. And so we joke around at work, and, you know, we do these different fundraisers throughout the year. But Muddy Miles is by far the most, I don't know, that is the funnest part of this job.
The pictures on Facebook were great.
That's right. We're all covered in mud, and it's a blast. And that happens every July. And it's been really fun. This was our second year. But we had, you know, repeat people coming back, and we have, you know, it's becoming this annual tradition. We have one family in the community. It's his son's birthday. I don't know, it wouldn't be every year, but that's how they celebrate his birthday. It falls right on that weekend. And that's how they celebrate their birthday. It's a birthday party. We had some people. It was a lady's 50th birthday this year, and she brought 15 of their family members. They were all dressed up, ready to go, and it's just a blast. But really helping us develop relationships and friends with the community is what those are all about.
And when you talk about friends with the community, we just recently had the Veteran Stand Down, and you all were a part of that.
Right.
You had the clinic in there, right?
You know, we actually, Justin Rader, our dental director, was there all day providing dental services. You know, we didn't have medical services there this year. This was the first time. And a lot of those patients actually have access to services within the VA, and typically when we bring medical there, they're not very busy, but dental is just through the roof. And so we focused our efforts on dental. We were there supporting the rest of the event, but you know, we care about our veterans, and Justin Rader, Dr. Rader, he's a veteran himself, and so this is very near and dear to his heart.
Well, I remember coming, because I was in the military surplus building, giving away military, and I came over and saw you guys over there.
Yep.
I thought, I figured I'd see you here.
That's right. We try to be there. I mean, it's like all the other organizations in town. You know, we have a phenomenal group of people that care a lot about this community, and you know, they're not going to quit. They're not giving up. They know that times are hard, and that now more than ever is the time that we need to come together as a community and just take care of each other. You know, quit yelling and screaming about stuff that's not working. We know how to fix these problems, and it comes when we all get together and solve problems.
And you work with a lot of the other agencies around here.
We do.
You work with St. Vincent and do some things. What are some of the other groups that you all...
You know, it's funny, all the different partnerships. I mean, any organization in the community, we really have relationships built in and work with them. You know, some examples are, you know, we have a great relationship with a Croc Center where patients that come to us and need to access gym facilities and lose weight.
Physical activity kind of things.
My brain's not working, but they give us scholarship for our patients, and so they're able to access that program. And that's great. You know, we work with the Boys and Girls Club. We love Ryan Davis, and we're so excited about the new Boys and Girls Club facility that's going up. I mean, that's another great example of what this community can get done. But, you know, lots and lots of other organizations, we want everybody to know that this is something that's happening. And, you know, just before here was over at Union Gospel Mission working with them on, you know, trying to put together the medical clinic that they're going to have over there. We're excited about them being in our community. We can't wait to see what they do. We're really lucky to have them here.
So this year has not only been a year of physical growth, but it's been a lot of relationship growth with the community. Because a lot of the things that I do in the community, I see you all there.
Yeah, I think for a period of our time, I don't know, maybe we weren't as involved in the community as we should have been, but that's just part of who we are. I mean, our name is Dirne Community Health Center, and that community is the heart and soul of our organization. If that goes away, then, you know, we're just another doctor's office. And, you know, not that that's bad to be another doctor's office, but we look at healthcare in a whole different way. And I don't know, it's just all about the community.
Well, and I think that is driven by the reason for your existence in the first
Right.
place. You know, that was the reason the whole thing was put together in the first place, was because healthcare wasn't there for everyone
Right.
in the community. So that's really interesting. Well, we need to take another break,
Okay.
but we will be back on the Senior Moment.
Time flies. You know, we can do a quick update on Everyday Wellness, because we got that up and running. And then, I don't know, what else? Anything else you can...
Well, you know what's been going on over there.
I know. Well, let's talk about Everyday Wellness and our women's care. We need to talk about that. Let's focus on women for a little bit and
Okay.
kind of the importance of getting their annual exams and
Wellness
some of those things
exams.
we got on, because we got that Purses for a Purpose coming up it's in February, but that's really targeted at women's health, and we can talk about
Okay.
moms not taking care of themselves and all
Okay.
those kinds of things.
Okay. You ready?
Yeah.
And we're back. Again, this is Connie Clark with the Senior Moment, and I've got Mike Baker in here, and we've been talking about all the things that Dirne Community Clinic and all of its new locations have been doing since they moved to their centralized location. And we talked about seniors and the new doctors that you've brought in, and we've talked about the pediatrics part for the children. And me being a female, of course, I'm going to ask you about women's issues, because I know for a fact, and I have friends in the situation who do not have health insurance, and they do not have their annual exams or their mammograms or any of those kinds of things because they don't have the money to pay for it. And then when something does go wrong, it's major.
Right.
So what's Dirne doing to help us out?
Now, this is a topic that's near and dear to my heart. I don't know. I look at my mom, and I look at the women in the community, my wife, and just everybody I know, and they are the last people that get taken care of, and it's by choice. I mean, like,
we're
I'm
the
nurturing.
caregivers.
I'm going to worry
Yeah.
about everybody else.
We're the caregivers of everybody.
And that's happening. And so, when a family has to make a choice between, all right, let's get little Johnny in and get him taken care of, versus, boy, I found a lump the other day and I'm worried about it, but we don't have money, we don't know what to do. Making sure that those barriers are knocked down so that people know, look, no matter what, if you've got a health concern, just get in, come in, don't worry about the money, let's get you taken care of. But we do a special day once a year. We're working on twice a year, but it's a day that we shut the whole clinic down to everybody else. We open it up just for women, and we do annual exams all day long. They're usually $10. I mean, it all depends on people's income and where they're at, but we do it so it's affordable. People can get in, and there's just trying to take that excuse away of, I didn't get it done because of money or access or whatever it was. And we have a group in town, the NAHU, the National Health Underwriters Association. They sponsor a Purses for a Purpose event, which raises money to help us fund that day. And it's just purely devoted to taking time out for women so that they can get their care in. We have some phenomenal providers. They love doing preventive care and working with women, but we find people, I mean, it's not uncommon to have somebody come in and say, well, I found this lump a couple of months ago and I didn't have money, I couldn't make it in, whatever that excuse is. They've been worried about that for several months, and if we catch stuff early, we can do something about it. And we need all these moms around, like, let's catch stuff, keep you healthy so you can help with all the awesome things that we have to do in this community. And so we're doing that. We're looking at a really fun event at the start of the year where we're just kind of trying to do like a women's night out. My wife thought it was a little weird, but she thought it was she saw how it would work. But what we see is that if we can do something that's just set up for women and it's a special night, we're looking at having people come in and provide massages and do hair and nails or whatever it is to have it be a relaxing night. and we encompass that night with, you know, a wellness exam and some health education. You know, we spend a couple hours together in a somewhat of a group setting. We think we can connect with people and really start making that happen. So we've got that in the works for the start of the year, and we think it'll be a great opportunity.
Have you got the mammogram equipment there at Dirne?
No, we don't. We can't do mammograms there,
Okay.
but we access. That's once again one of those great partnerships with the Susan Komen Foundation and Panhandle Health District. We are able to get women in for mammograms. There's lots of details about who qualifies and how that works, but we've got people that can walk you through that. But really, at the end of the day, we can get you in for a mammogram. It's going to be affordable.
That's what I was going to say, because
Right.
if you would go in on your own, it would probably be very expensive,
Right, it
especially
is
if you were paying
expensive.
out of pocket.
Right. And through our partnerships, we've been able to come up with something that's affordable for women.
Oh, okay.
As it works. And it really is all based on your income and, you know, all those things as we go. So it's hard to throw out what it would cost at this point. But, you know, come in, we'll work with you. We'll make sure that stuff can get done and that you can stay healthy. I mean, take care of yourself. We need you.
So they would do your pelvic exam and that sort of thing there, but they would have to give you a referral or something to go have
so we end
the
up referring out for the mammogram just because we don't have the equipment on site.
But it's not something you need to be afraid to do, that it's going to
No,
cost
not
you
at
an
all.
arm and leg.
Not at all.
Okay.
Yep.
Okay.
There are resources out there to help make that happen.
Now, so far as ongoing wellness,
Mhm.
you all have a program dealing with that
We
too,
do.
don't you?
Yeah,
That's something
it's
new
been a
that you-
busy year, hasn't it?
Yes, it has.
We launched, our board of directors came to us last year and said, you know, look, we have all these families, and if you look at the demographics, you have a lot of people that make too much money to qualify for any subsidized care, but a family insurance plan is just, it's not affordable for them. And you have small businesses that are trying to figure out how to retain employees, but, you know, they may not be big enough to qualify for health plans, and, you know, their margins may be so small they can't afford to offer those benefits. So they came together and said, put together a plan that will, it's not insurance, it's a, you know, a membership type of relationship, but that can cover a family of four for less than $150 a month. And so we put that together. Adults are $50, kids are $20. And what it does is, once again, it's not insurance, but everything that you need that we can do under our roof is covered under that. We have a little fee we have to add for some lab services. It's about $15 for a lab. But anything we do inside our building, it's covered. So once again, we're trying to take that excuse away from families about, I don't have money, so I'm not going to go in and take care of myself. You know, we see this all the time where families, you know, budgets are tight, and so to go to a doctor when you're healthy doesn't make any sense at all. I mean, it does, but financially doesn't.
Right.
And so we really are trying to knock down those barriers. And so this program allows a small business to either cover some of that cost or pass that on directly to their employees. But it's out of their check. It's done. There's no copay. Like, there's no excuse on that day to not come in because it's all covered and done. And, you know, you can do it. And we encourage your first visit's a 40-minute appointment with the doctor where we talk about your goals for the year. Like, we want you to do it when you're not sick. And, you know, we sit down and say, do you want to lose weight? Do you want to eat better? Do you want to stop having so much stress in your life? Let's make a plan and work together over this next year to get you back to get you to a spot where you want to be. And it's so cool to watch. It's really fun.
Now, do those plans cover immunizations and flu shots and all that kind of stuff?
Yeah, I mean, pretty much whatever we do inside the facility, we can cover under that $50 a month. There are just a few things that are built in, and, you know, we walk that through. But the goal was to say it's affordable, take away the excuse not to get your health care, and you know, keep it to where it's reasonable for families to take care of themselves.
Is that are immunizations something that Dirne still does? Because I remember seeing something about that some doctors' offices weren't going to be doing that anymore, or something
you know, I
along
don't know
those
where
lines.
what that one is, but yeah, we do immunizations all the time. They're affordable. We have a partnership for kids with Panhandle Health District and the Vaccines for Children program. You know, most kids can walk in and, you know, those vaccines are free. Idaho doesn't do a good job of immunizing kids, and I know there's a lot of controversy around that. But man, I don't know, I immunize my kids. I want to give them the best chance in life, and we can do all of that.
So coming into the holiday season, we're now starting to get into the craziness of all the holidays. What can Dirne do, or what's going on in Dirne that might help us to get through these, or that we may need to know so that if something happens?
Right. Well, I mean, I think the biggest message that we try to work on this year is we're there for you when you need us. And we're there for you when you don't need us. I mean, really, we want to make sure that when you've got a problem or a health concern, and, even if you don't think it's worth it, like, just come in, let's catch it early. And so, this season, obviously, we're all worried about the flu.
I was going to say flu season, yeah.
We've got flu shots available. I think I probably shouldn't say the price, but I think it's only $15. Don't kill me if it comes in it's 20, but I think it's $15. We tried to make it very affordable. If it's either $15 or $20 for a flu shot, come in and you can just walk in and get that done. Wash your hands, be smart with what you're doing, and then, let's catch stuff early on as you go through so that you can enjoy the holiday season. We know that kids are back in school, bugs are starting to flow. Let's make sure that you can enjoy this holiday season and be healthy as you go forward. But we have same-day appointments. I mean, it's rare that we can't see you today if you've got a problem. And if for some reason the lobby's full of really sick people, we'll get to you tomorrow. But it's not weeks and weeks and weeks. And as you're looking at your sort of your year this year and your charitable giving, one way to really be a part of it is come bring your health care to us. We'll do good things with those health care dollars and help you do more with that. And you feel great when you come through and know that you help somebody else.
Well, you have accomplished a lot in these past 12 months. What are you looking to accomplish in the next 12 months?
Yeah, if only I could open it up and show you. It's phenomenal. And it's only because of the community in where we live and the people that are around us. I mean, our opportunities are endless. Like, we're not going to stop until everybody has access to health care and that we are living healthier lives. And so, our goal is to continue to put new facilities in locations as the communities need us. We've been talking about a facility in Post Falls for quite a while. That's in the works. It's happening. I anticipate it happening next year sometime. We love the Silver Valley. We think there's a great relationship that we can have up there. So we're really just trying to figure out how we meet the needs of the community and be a resource for folks in the community and be a part. I mean, it's a huge deal for us to help out with little kids soccer teams or whatever it is we can do. We want people to know that we're here for you, and you guys have been here for us forever. We're just barely breaking even, as an organization. That's our goal. We don't have these lofty projections. We have to make lots and lots of money. Any dollar that we make goes right back into patient care, and we're going to keep doing that. I mean, it's just it's what we do.
And one of the things I remember that you talked about last year that you wanted to do was to see if there was a way to get an X-ray machine.
Right.
Is that something you're still working on?
Oh my goodness, yeah, we have. So Kootenai Health is once again a phenomenal organization. They give us $150,000 a year in just radiology services, which is phenomenal. This year, because of the increased demand, we actually burned through that in July.
Oh my goodness!
So they've been great. We're working with them and with Northwest Specialty Hospital. There are some resources available, but at the end of the day, there are lots of things that we could do in house, and so X-ray equipment's really expensive, and you could spend $100,000 on it really easy. We've actually identified a great unit that's about $20,000 that we could bring in house. We could provide X-rays on site. We've got to find a little bit of money to help put that together. But being able to shoot an X-ray in the clinic is just huge. You don't have to go somewhere else. We can do it we can do it for less than anyone else. Especially if we have the help getting the equipment. It doesn't cost that much to do an X-ray, and so we can keep it affordable and make it happen. So we can't wait to see what what we can get done there.
And you know that I'm asking you these questions because when we come back in a year,
Right.
I'm going to ask you about them.
Right.
You know, and
Well, I'll bring a picture of my arm and the X-ray machine. How about that?
that would be very good. That would be very good. If there's any final messages for people listening, what would it be?
Sure. Well, I mean, once again, just we're so grateful for the phenomenal support that we've received throughout our existence. I mean, we've been around since '85, and every year of that existence, amazing things have happened. I'm more biased because I've been here the last 3 years and I've seen what's happening, and I just feel so blessed to be a part of it. You know, we just know that, you know, we want to be a huge part of the healthcare delivery system in this community. And, you know, knowing that you have a healthcare organization that's led by you, it's led by patients, it's not led by anyone else with any other ulterior motives other than we have a mission to make sure that we have access to healthcare and that our community is healthy and that it's affordable for everybody. Knowing that there's an organization around like that should just light you up. You should know that, you know, that's what we need to do with healthcare. You know, put it back in the community and let people put it together, because the magic happens when people get together and they say, hey, I can provide this and you can do that. I mean, we have all these cool things that are coming up to us because we've been open and receptive to looking at these opportunities, and it's so cool to see what's happening.
Okay, if people don't know, tell everyone where your location is.
Perfect. Yep. So our medical and behavioral health location,
there you go.
for now,
for now,
are at it's 1090 West Park Place in Coeur d'Alene, right next to the senior center, and it's on the same street that you would use to turn into Riverstone, into the movie theaters down there. Instead of turning right, you would turn left.
Just go the other way up the hill.
Just go the other way up the hill. We're right there. Our dental clinic is located over on Lincoln Way, right next to Little Mo's Eyeglasses Shop. That seems to be the landmark that everybody knows and understands. And then should I give our phone number?
Sure.
Our phone number, if you have any questions, is 208-292-0292.
And that's one of the things you got this year was a new phone system.
We did. Yeah, you shouldn't be on hold very long. If you're on hold a long time, please tell us. You know, I think the first day we moved in on our phone system, I think we counted like 3,000 to 5,000 phone calls that came through that day.
Wow.
And, you know, I mean, we have a tremendous volume of people trying to get through. So we've hired additional staff. We got a new phone system in. We try really hard not to have you waiting on hold a long time. It breaks my heart, you know, when we let people down. But know that we're doing our best to get a hold of everybody. And
where's your new Rathdrum location?
So the Rathdrum Clinic it's actually Rathdrum Clinic. It's Dr. Whiting's office that's up there. It's right by the Head Start and the Senior Center up there. It's on Chemo Court, which is on the left-hand side of Highway 41 if you're headed into town.
And you all have a Facebook page.
We do have a Facebook page. We love having everybody on there. It's a great way to communicate with people. We actually have it showing up on our TV screen in the waiting room, so our patients are watching all the things that you're putting on to our page. And it's fun. It's, once again, another way to build relationships, and you just search for Dirne Community Health Center on Facebook. We're there. There's lots of fun pictures and
yeah, that's how I know what's going on with
right.
you folks, is I keep seeing Alan posting all of those things.
Yep.
And your website?
It is www.dhcidaho.org.
So there's all kinds of ways to get in contact with you all to find out information on what's going on. There is no excuse.
No, none at all. And, you know, I put my personal phone number out there for everybody. I mean, I want to hear from you. If there's an issue that you faced or you have an idea about how to work with us, you know, my number is 292-0256. And that's my office number. I get right back to you. I love hearing from people. You know, that the hardest part about running a business is if there's a problem, you don't know about it. You know, we love hearing about it. We do our best to fix things and get it going, but it's wonderful to hear that you've had a great experience. So if you had a great experience, give me a call every once in a while and let me know.
Very good. Well, thank you, Mike. I
Thank you.
appreciate you being here. And this has been Connie Clark with the Senior Moment. And you all have a wonderful and try to stay warm weekend. Good day.